So this will be our last video on blood transfusion, which we have spoken about various types of blood constituents that are available for transfusion. We spoke about a frozen plasma. We spoke about platelets concentration. We spoke about the blood clotting factor concentration. We spoke about red cell concentration and so many other constituents of blood that are available for transfusion. Okay, so on that basis, we'll be extending the same knowledge to the whole blood. But whole blood, I kept it last because whole blood is kind of like the most common type of transfusion that is done in hospitals. Mostly for us that live in less developed countries. It could be that somebody just need a platelet, but there's no machine to even separate platelets only. Okay, so they just end up giving the whole blood to the person. All right, so whole blood is kind of like the most common transfusion that we see around this part of the world. Okay, so we say that whole blood is actually a type of blood transfusion that contains all components of blood. Okay, and these components include red blood cells, white blood cells, platelets, plasma. All right, now whole blood transfusion is used to replace blood loss due to trauma, surgery, or bleeding disorders. All right, it can also increase oxygen delivery to tissues. All right, it can support blood clotting. All right, whole blood can support blood clotting. All right, so just like I said, is the one of the most, even me, I've donated blood so many times. Okay, and I know that same blood, they are giving it to people that need only white blood cells. They are giving it to people that need only plasma. All right, they give them as whole blood and all that. All right, we are not really developed to separate all those things yet. So however, whole blood transfusion has largely been replaced by component therapy. That's in developed centers. All right, now this is where the specific components that the patient needs, that is just what you transfuse to the patient. Okay, if the patient need red blood cells, you do a packed cell, you do a packed red cell, then you transfuse. Let me say maybe they are anemic or they lost some blood, so you do some packed cell and you transfuse. Okay, if they need only plasma, you do some fresh frozen plasma. Okay, that's possibly if they are having some coagulopathies, that's some diseases related to coagulation or bleeding disorders, you give them. Then if they are thrombocytopenic or probably they have low platelets, okay, or if there's a platelet dysfunction, then you also transfuse, adjust the platelet concentration. Then cryoprecipitate for fibrinogen deficiency or bleeding disorders. All right, you also transfuse this to them. Okay, so this approach of transfusing just what the patient needs, okay, is to alleviate some possible things. Like for example, if there will be a transfusion related complications like iron overload, somebody need platelets, you are giving them full whole blood. Okay, it can lead to accumulation of iron in the body because hemoglobin have this iron stores. Okay, so it can lead to iron overload, it can lead to some allergic reactions, it could lead to infections, it could lead to volume overload. Okay, so this is a whole blood. All right, so whole blood is still used in some cases, such as there's a massive bleeding or hemorrhagic shock. Then also it is used in exchange transfusion in neonates, and if there are some military or emergency settings, you don't really know what the patient need at now. You don't really know if the patient need plasma, fibrinogen, platelets, and there's no time to start doing all those tests to know what the patient need. You just transfuse whole blood. All right, then another situation is it is used because of some centers are not really developed. Okay, because of some development issues. All right, so guys, that's it about whole blood for transfusion. Okay, and bye for now.